Hello and greetings. Once again, my name is Kelvin Ampofo. I have the pleasure, I have the honor in serving as the second district representative of the Omega Psi Phi Fraternity Incorporated. And here we are again with our monthly webinar series as it relates to COVID-19. Those of you joining us for the first time, thank you so much for joining us. Uh, as usual, we're going to get right into it. Let's start off with hearing from the brothers out of the second district we have identified as the horsemen. These are the doctors and or government workers that work directly with the White House, giving us information that you just simply won't hear anywhere else. We're going to start off with our doctors in order. We're going to go Dr. Boykin. We call him 78 in our fraternity. Dr. Boykin, it's always a pleasure. It's always an honor to have you, my brother. Let's start off with just your opening comments before we get into it tonight. How would you like to start off with your opening comments on this evening, my brother?
Well, thank you, brother DR. Good evening, everyone. And again, welcome to our monthly webinar. I'm going to be very brief in my openings because I think there's a lot of things that we could discuss tonight. Certainly that the most important thing to recognize is that this COVID-19 pandemic is not over, and there's a new player out there that you've probably heard about that will probably significantly impact the curtailing of this pandemic within our borders, and that's the Delta variant. We'll probably speak a little bit more about that later on. But the other thing that's come up is some new side effects from some of the messenger RNA vaccines that have come out that we need to discuss. Again, as with any vaccine, not everything is always known during the trials because we don't do 100% of the population. We do a certain sampling of the population. So we'll talk about those things as well. And we also talk about what's the importance of children being vaccinated? Why should they be vaccinated, particularly if they're over the age of 12? And I want to say that's very important, and we in time is of the essence because we're getting ready for the school year coming up now, and to be fully vaccinated, now is the time to start getting those kids vaccinated, as well as catch up on the general health things. Other health things out there, those are probably the major things we need to talk about tonight, particularly as we get towards the 4th of July, which is just around the corner. People will be gathering, things they need to think about. People that are fully vaccinated versus not fully vaccinated, people coming from different areas, indoor versus outdoor, all those things going to impact the 4th of July holiday or our Independence Day. Also, it impacts the way you travel. I had the opportunity recently to fly for the first time in probably at least 6-7 years and saw the difference in how things were done post-COVID. Isolation and quarantine in a lot of people. It should also be noted that if you are a vaccinated person, but you do have an underlying immunodeficiency or immune suppressive disorder, you still have to take extra precautions, even if you're fully vaccinated. You should probably consider yourself fully vaccinated, but still need to wear your mask at all times because you are at risk. So those are some of the things I think we need to concentrate on tonight. And I'll be certainly glad to answer any questions as time permits tonight. So with that, I'll yield back to you, Brother DR.
Well, Dr. Boykin, as always, you always give us the greatest information. We thank you so much for sharing your experience, certainly as a pediatrician. And we just look forward to more conversation from you on this evening. Our guest, family, our next doctor that we have with us certainly is no stranger to us. Dr. Jedan Phillips was at the epicenter when this thing started, right out of New York. He was there in the emergency rooms dealing with this pandemic when it first began. And he's been with us along with Dr. Boykin throughout this whole pandemic. And so with that, Dr. Phillips, good evening, my brother. It's good to see you.
Good to see you as well, my brother. Good to see you as well.
Yes,
Good
sir.
to see you, 78. I hope all is well, my brother. Well, I do think tonight is critical because we are about to come upon the July 4th weekend, and we're at a critical phase. I know we have seen some opening up of the country and of our lives. However, there's still tremendous risk here because the thing that we are seeing is that the variants, which are becoming increasingly more concerning, are more dangerous for individuals and spaces where you have higher rates of unvaccinated people. So as we look at getting together this weekend for July 4th, recognize that even though you may be vaccinated, as we've talked about, there is a possibility that you could get infected. And if you are infected and around other individuals that are not vaccinated or are at risk, those individuals unfortunately run the risk of developing a serious situation. This Delta variant, we talked about the UK variant previously, and its increased risk of infection. The Delta variant is even more infectious than that. And what they're saying is we're probably going to see it become the major variant in the entire of the United States, probably within the next month or so. Thus far, we are seeing clusters of areas where you've seen increased cases. And unfortunately, in those increased cases, some of the commonalities are unfortunately low rates of vaccination. So with that being said, we've got to really be mindful as we go into this weekend of being safe. Now, we've gotten some good information about with the messenger RNA vaccines showing that they have good effectiveness and maybe even a longer immunity than we had previously thought. So that is something that has come out in some preliminary studies, which is exciting. In addition to that, we've also seen that there's some success, especially with the messenger RNA against this Delta variant. So again, you know, that vaccination can protect you from the Delta variant. And as I said, if this variant is given more opportunity to infect people, then the opportunity for it to continue to mutate, and maybe the next mutation might be able to sidestep our vaccine. So the longer the variants are out here, the longer they're existing at high rates, the more risk that we have for populations and clusters of individuals that have not been vaccinated, because unfortunately, over 99% of the new cases that we are seeing with COVID, over 90, a high rate, absolutely virtually all of them, hospitalizations and deaths that we're seeing, unfortunately, are happening in individuals that are not vaccinated. And as we look at returning to normalcy, as we look at the new school year coming, again, they're already starting to talk about we needing to go back into doing some more intensive protective measures, possibly because of what is happening around the world. We've been fortunate, even though we're only at about 49, maybe 50% of people that are fully vaccinated, and at about 66% of people that have received the first shot. We unfortunately are unlike other places in the world. Other places in the world have places where they have not even had 5% vaccine rates. So already in 2021, we have seen more deaths internationally than we saw in the entirety of 2020. And that tells us that this virus on an international level is a serious thing. There we go to the WHO recommendations that they made today about even fully vaccinated people being wearing masks. And if you're in the United States, well, what do they mean? Is that confusion with us in the CDC? No. What it does mean is that we've got to now start looking at this from a global perspective, because if the variants are allowed to gain momentum, increase their numbers, then the ability for them to continue to mutate and maybe mutate into something that can sidestep some of the protective measures like a vaccine that we've taken, we may be back to where we were before. So for our world family, the more of us that get vaccinated, the less of a space that these variants have to continue to multiply and to potentially continue to mutate. So with that, I'll yield my time. I think, again, this is a great moment to have this conversation again, because we are going into the holiday weekend and we need to exercise some restraint and some awareness as we, the people, go into it. Thank you.
Well, Dr. Phillips, as always, thank you so much. So let's just, before we get into this, let's just take a pause, because obviously from the standpoint of you all as doctors, you certainly have one perspective, you certainly have one view. So let's just we have a significant number of guests tonight, some that still may be considering the vaccination if they haven't been vaccinated yet. If we could, let's just talk about the vaccine. The vaccine. Obviously, there's been this big push to get everybody vaccinated. So as we look at the stats, more and more people are getting vaccinated. Then we were told if you were vaccinated, you didn't have to wear a mask. Now people are hearing that, well, you probably still should wear a mask. So if we could, let's just talk about the vaccine. What's intended purpose of the vaccine? Because I hear from a lot of people, they say, hey, listen, I know somebody that got the vaccine and they still got COVID. Why do you want me, or why should I take the vaccine? Let's talk about the vaccine and its purpose and its intent, and then we can go down another road. Dr. Boykin, please, or Dr. Phillips, you want to start?
I just wanted to say one thing. When we start talking about comparing what the WHO and the CDC says, we need to look at what is the WHO responsible for. They are responsible for what is now an out-of-control pandemic internationally. We are fortunate to be in a space where we have the availability of mitigating factors, the support of our government, and the availability of the vaccine. So when we look at, the CDC is saying something different than the WHO, the CDC is reflective of the United States, which is not the reflection of what is going on in the world. So I'm going to yield my time. Dr. B, you got it, bro.
Thank you. Well, you're absolutely right, because I think the one thing that you brought up earlier that people have to understand now, we are trying to contain this pandemic in the United States, but we have a new player called the Delta variant, as we've been speaking about so much. And the Delta variant is fast becoming the global variant that's going to really affect how the world responds or recovers from this. I mean, to the point now, we've now begun to send some vaccines to some other countries because we need to get into that space and get those people vaccinated, because if we're going to travel, if we're going to open up borders and have people travel in, there's always a possibility that a new variant can come into our midst. Matter of fact, we're talking about maybe some variants of the variant, but we won't get into that tonight. So that's always a possibility. But as I said before, many times I've spoken, is that I personally want to wear my mask because first of all, before I get into that, the vaccines in and of itself, what are they designed to do? No vaccine is going to ever be 100% effective about preventing a disease. If it did, we would just give a vaccine and don't worry about a pandemic. The vaccines are designed to decrease the severity of the disease if you would get COVID-19, and it's supposed to keep you from being hospitalized. That is the main focus of the vaccines. Now, some of them have a greater efficacy than others in terms of those numbers. Some of them were tested during a downtime. Some of them were tested during a high time. So in and of themselves, the vaccines are designed to prevent you from having a very, very severe disease and being hospitalized. So that's what they're designed to do. So to that end, if you hear someone say, well, so-and-so took the vaccine and they still got COVID. Well, yeah, they still got COVID. They still had COVID because you're going to have some. Remember, the vaccine is designed to decrease the severity of it, so you still can get COVID. But if you're vaccinated, if you want to break it down to a scientific level, the number of virus particles, or what we call the viral load, in a vaccinated person is much less than that of a person that's not vaccinated. In other words, the circulating amount of contagion, if you will, or antigen, if you will, in the vaccine would be a lot less if you're vaccinated or somebody has been vaccinated. If you haven't been vaccinated, then your load is just like any other person out there in the wild. You got this variant. What's going to be your viral load? I don't know. But I know one thing, with this Delta virus being more transmissible, even more so than the United K one, which we now call the Alpha variant, the B117, is even more transmissible than that. It's even prone to more serious disease than that one. And that one was pretty significant when it hit the UK, and then the Delta hit India. So we're really looking at how these things can really rapidly mutate and infect what we're trying to do. We're trying to contain this pandemic. And if we don't get a hold of these things and have more people vaccinated. I don't know why people are afraid to take the vaccine. I don't know why people think it's a downtime for the vaccines. It's not a downtime for the vaccine. And again, let me just preface it by saying I'm not here to beat you up if you don't take the vaccine. That is not my intent. There's a personal choice between you and your primary care physician. Because only you and your primary care physician know your overall healthcare state, your health status. But if you are seriously considering the vaccine, this will be the time to get it. If you ever want to return to normalcy, this is the time to consider getting the vaccine if you're thinking about it. If you're on the fence about it, read the data. The scientific data is out there. Look at the things that are out there. Look at the factors that are affecting us getting back to pre-pandemic. I don't think we ever get back to that point, the same normalcy we had. But if we want to get back to any semblance of that, then we can even get more pockets of unvaccinated people vaccinated. Because when you look at the deaths of those people vaccinated and died from COVID-19, that much compared to the general population. So I'll yield my time back with those words.
Dr. Boykin, you bring up a good point and an interesting point when you talk about the vaccine and then you talk about the deaths. Let's just quickly, there are stats of people that were vaccinated that not only caught COVID, but also passed from it. Is there what do you say to the person that's saying, well, I know people that got the vaccine and still, passed? Dr. Boykin or Dr. Phillips, please.
Well, you look at in the beginning in June, they had about what they called fit breakthrough cases, which are individuals that have had the full vaccination and come up positive for COVID. Of that, about 90% of them were mild situations. Of the remaining ones that were more serious, they were individuals in most part that were over the age of 80, which, as Dr. Boykin just alluded to, would be at the fringe or have a higher risk. So therefore, again, individuals that were high risk were the ones that had these deadly effects of reinfection. And we already are making those recommendations that even if you are vaccinated, if you are autoimmune or have an immunocompromised condition, or you're very old or elderly individual, you need to still practice some safety and mitigating factors because the vaccines may not be as effective in you as it would have been or is in someone younger.
Absolutely. Because if you look at, let's just put it out there where it is. Compare the number of post-vaccinating deaths from COVID as compared to the overall population of deaths from COVID. We're now over 600,000 deaths in the United States. How many of those are post-vaccinated people? Very, very minute amount. Very, very minute amount. I mean, like I said, any vaccine, you could have some breakthrough. If with any vaccine, we have not, the only one that we have completely eradicated in the United States are two, polio and smallpox. Those are the only two we completely eradicated. All the other vaccines out there, the preventative, the maintenance vaccines out there are just that, to prevent you from getting infected and hopefully give you some lifelong immunity, which, by the way, studies are now seeing that these vaccines that we have now may give lifelong immunity. There's a recent study that came out that's showing that, the messenger RNA vaccines may give lifelong immunity. And we talked about before, maybe not on this forum, but we talked about before that, some of the cells that reside in the bone marrow, the B cells, the cousin to the T cells, if you will, the plasma cells, those they can have immunity or memory for a long time. They can sit there and go by themselves, go quiet, whatever they want to do. Then along comes COVID-19, and the B says, "Hold up, no, you're not getting up in here." So they'll reactivate your antibodies and attack them for you as a result of the vaccine, and also those people that had already had COVID to some degree. So we know that the vaccines are very effective. As a matter of fact, as Dr. Phillips alluded to, the vaccines are effective against the Delta variant. Moderna has the highest reaction to protecting against the antibody production, if you will, to the Delta variant. So all is not lost out there. The vaccines are still doing what they're supposed to do, but we just got more people vaccinated, because those pockets where Delta variant can get into and just go crazy will put us right back to where we were before if we're not careful.
Let me bring
I just wanted to say one thing, brother DR. we actually are in the midst of a cluster outbreak at a sleepaway camp in Illinois right now, and a majority of the participants were not vaccinated. So they now have 85 cases at a sleepaway camp, probably majority of them Delta, if not all. And again, in the population that is unvaccinated, which is where these variants are looking. And as we go into school coming back, as we go into the fall, those pockets or clusters where there are high rates of low vaccination, those are areas that could keep the viral load, as Dr. Boykin just said, high. And if we have a high viral load in the environment, then we have triggers to cause mutations, which could render, as I said, the things that we've already started using as defense ineffective.
Let me bring in another horseman. Again, those of us that have been here, we know this brother. We know his story. For those of you that are visiting us for the first time, I'd like to introduce to you Brother Wonzie Gardner, who works with the federal government and always has information. And what I'd like to do is either Brother Gardner, thank you so much for joining us. Certainly, Dr. Boykin and Dr. Phillips, just to get off the topic of the vaccine, because I know it's been beaten like a drum, but obviously we feel a certain way. We want to make sure people are informed as it relates to the approval of the vaccine. I don't know if Brother Gardner wants to speak from the federal side, or if you all want to speak as it relates to, being the doctors here. Some people would ask, well, how come the vaccines are still not fully approved? We know they got the emergency authorization, but the full approval of the vaccinations.
I'll take that real quickly, and I'll leave some room for Wonzie as well. If we have to remember that these vaccines were originally authorized, not approved, authorized under emergency use only. And to date, the mRNA vaccines, both Pfizer and Moderna, have applied for full authorization of full approval, and that process takes some time. Now, they applied for this back in May of this year, but it may not be until sometime in the fall that we see anything that they get full approval, because it goes through a little bit more stringent process than just emergency use authorization. So that's why we haven't seen any fully approved messenger RNA vaccines right now from the CDC and FDA's standpoint. I'm not sure what the FEMA or the office that Brother Gardner works in, but that's the information I have on my end as a clinician.
Good evening, brother Amfofo, Brother Boykin, and Brother Phillips. I don't want to dispute anything they've said. And if I could, I'd like to change the conversation, because one of the things we're working at today is that the messaging has gone out about the efficacy of the vaccine. And to date, people have made a decision, and some will change their minds as to whether they will get the vaccine or not. That's a proven fact. There has been call outs from all venues across America about the importance of the vaccine. So the shift now is on how do we get to what we call a steady state. We learn to live proactively but protectively in this environment as we go through, because COVID-19 is going to be here for a while. And the question is, how do we go about our daily lives now in a way that we protect ourselves, we mitigate risk as much as possible? I love what my brother is saying, and everything they said is all true. But the fact of the matter is, Americans have decided writ large that they're going to go on with life. And the concern we have now is, how do we do that in a safe and effective and efficient manner? And one of the things that we're doing is now we are slow rolling a gradual opening, because some pockets are already open, a gradual opening of the federal government back to a service industry as we were before. And the target date now is 30 September or 15 October. And you might ask why it's taking that long for the federal government to reopen back up. And why businesses are looking at that is because, number one, they talk about variant D. And Brother Boykin already talked about the mRNA vaccines are supposed to be effective. And the efficacy rate, I think, as high as 86% for Moderna. Pfizer's going to come out and say tomorrow with theirs. And Pfizer's supposed to be 82.5. So Moderna this one time is supposed to be a little bit better than Pfizer, but that's you protect it. But the real question that we have to ask as a fraternity and as brothers is, how do we go about living in a world where COVID is all around us? Again, the question is, how do we go about living where COVID is all around us? There's two schools of thought. One is you hunker down, you don't do anything. Well, about 20% of the population is going to do that. The other 80%, that includes those that are not inoculated, they're going to go on about their lives. So the question, the message that we're trying to send out now is, how do you make the most reasonable expectation of covering yourself and your families? Because of right now, that the vaccinations only go to age 12, and there's a large part of our families that go beyond below age 12. So one of the things that we're doing in the federal government is, because right now, based on the HIPAA laws, you can't ask a person whether they've been vaccinated or not. But at the same time, we want to bring people to work. The problem is there are a myriad of reasons why a person may not be vaccinated, other than they don't want to be vaccinated. And so the issue about masking is coming back again. I think you guys may have seen the news today where LA County is recommending now that anyone in indoor facilities wear a mask again. And the question is why? The answer is this: the D variant is supposed to be a super contagion that spreads all kind of ways. And the question is not whether or not you've been vaccinated, because if you've been vaccinated, you're good. You may get sick, but you could be a carrier for those others. And I hate to sound very crude and cruel, but at this stage in the game, if you are an adult age 12 or older, you have an option to choose whether to get a vaccine or not. And if you don't, shame on you. I don't mean to sound cruel, but you open yourselves up. My concern is those little kids, 12 and under, that don't have that choice yet because there's not an emergency use authorization. So the messaging we're trying to send out now at the federal government level is this: take the vaccine if you can. If you can't, take those measures that you can to protect yourself and others. And so while I hear what Brother Boykin and Brother Phillips are talking about, they are absolutely correct. But the reality is how do we protect ourselves going forward? Let me give you a microcosm into some churches. One of the things the Black church is looking at is the fact that as a private entity, we can ask whether you're vaccinated or not. Most Black churches are packed. We don't have the social distancing that others have. So it's a very catastrophic effect. So our church, and here in the Alexandria area, we're not planning on coming back into the full sanctuary to probably late fall, October, November. And here's why. We don't want to take the risk of having or encouraging people to come back out into an environment that we're fully out of control of. So I was talking to my pastor the other day, and he says, Wonzie, I want to change the paradigm. Our new normal will be virtual and private virtual type services with a few in-person people coming. Whereas before it was always everyone come to church, you had an online thing as secondary. But no, we're trying to lead this effort to say, as a community, as a bastion in our community, we want to be leaders and say, hey, we're not going to jump out there right away and say, hey, the church is wide open, everybody come back in, because we're like, I'm not going to call it a mega church. We're a big church, over 10,000 members. Smaller churches may do something differently. But as leaders in the community, we've got to make sure we set the right tone, the right tenor, and the right standard as we move forward this, because it has not gone anywhere. And so while Brother Boykin and Brother Phillips are beating everyone up on the head, and they rightfully so, I want to take a measured approach and say, yeah, they are absolutely right. But the same token, the question, the conversation we should be having tonight and going forward is, how do we live in a time where COVID reigns and everyone's not on board with taking the vaccine? What do we do to mitigate those kind of situations? And how do we make sure that we protect ourselves to the maximum ability possible? What do we do in a world where people are not on the same page and still life goes on? Schools are going to reopen. The government will reopen. Businesses are doing what they want to do. People are going back out to restaurants. Whether you're vaccinated or not, people are doing those kind of things. And I'll give an example. As you all know, my daughter died. The 26th of June was her death anniversary. So my wife and I left. We didn't want to be here. We went to Jamaica. Jamaica has only 7% of their population vaccinated. Didn't know that until I bought the ticket. Okay. But before I left, I took a COVID test, and the resort said they'll give you a COVID test on the way back out. Now, on our way back here, one of our girlfriends went with us. Her feet started swelling up on her really bad. I just got a call from my wife. She just came down. Our friend Angie Cook, we call her name out. Her feet are swollen, and she's gotten blood clots. The doctors just said to her, The blood clots probably came from the Pfizer vaccine, she said. Now, on top of that, Angie's comment was, I've got blood clots, but I'm still alive. She said, I got blood clots, but I'm still alive. Okay? Because we decided, in order for us to maintain some semblance of normal life, we're going to get the vaccine, which we did. Okay? We were taking all prudent steps, but she got blood clots. So she's getting that the Boykin thing, they call it a blood thinner, to thin out her blood or whatever. They put a prescription or whatnot. So there are risks. There are things that people have to worry about, but you have to look at the totality of either taking the vaccine or not. And you also have to look at the totality of life, because life is not stopping. It's not stopping. So we've got to make sure as we send these messages out, we are realists and understand that people have got to go on with their lives. So what we should be focusing on is getting vaccine number one, but also having strategies and methodologies to protect ourselves as much as possible as we go in our everyday life. For example, outdoor arenas. Now, I'd go to a Nationals baseball game because it's outside, but I'd be kind of leery going to a Wizards game in an indoor stadium where I don't know what the the filtration system is going. I don't know that. Okay. Some are older buildings. We're concerned about the HVAC system and the filtration system. So you got to look at yourself. Outdoors is fine. Stay away. Indoors, you got to look at it. And each person, each individual, to a man and a woman, have got to make the decision for themselves and their families. If you got young children at home that can't be vaccinated, I'd be really leery about going out someplace, because I could be a spreader, come back to my family with my kids or elderly people that could not take that. So it's an individual choice. So one of the things I'd like for us to start looking at is, how do we mitigate, and what kind of strategies can we come up with where we can go about our lives, recognizing the fact what Dr. Boykin and Dr. Phillips was talking about getting vaccinated. What do we do to protect ourselves?
And Brother Wonzie, that's phenomenal, my brother. That's amazing. Thank you so much. Let me, if I can, Dr. Boykin or Dr. Phillips, please, because one of the things, well, Brother Gardner said a whole bunch of wonderful things, but again, let's remember those that hear what they want to hear. And again, we're not here to convince people we're just simply here to share information. But I talked to a number of people who hear just exactly what Brother Gardner said as it relates to impacts, or other words, side effects, right? The blood clots, this happened. Can you just talk to us from a medical background perspective as it relates to everyone is different? It's not the same for everybody. Can you speak to side effects as it relates to the vaccine and just in general?
Well, I'm sorry. First, I want to make one correction, and then I'm going to hand the baton back to Dr. Phillips. But the clots do not come from the messenger RNA vaccine; comes from the J&J vaccine. Let me just make that clear. Now, there were some anecdotal studies of some clots in the initial trials, but the majority of those came from the J&J vaccine. So I'm not sure how that got related. And there are some new things out there in that age group of 12 to 30, adolescents, 12 to 30-year-olds with myocarditis and pericarditis. So that's a new thing out there. But what we've done is we've again, as with the J&J vaccine, we've changed the packaging inserts or the information, prescribing information to include those things. But it's very, very rare. Very, very rare. I mean, I can give you the breakdown if you want to of where the numbers are. But I say to those people, I traveled last week. I traveled through, I don't know how many states I traveled through, 5 or 6 states on my way to memorialize one of my line brothers. And as I was passing through those states, I make note of the fact that what were people doing? People in Georgia were doing one thing. People in Alabama were doing one thing. People in Mississippi were doing another thing. And lastly, in Louisiana and Texas, they were completely different. Each place I stopped, I made note of who was wearing the mask and who was not. And surprisingly enough, I saw more of our people not wearing the mask, not washing their hands. And I saw more elderly people that were not African American wearing the mask and washing their hands. And that to me was very, very disheartening, because if you don't want to get the vaccine, as Brother Gardner says, at least take some protective measures. Wear your mask, wash your hands. Like if you go to international, or if you go to any of these truck stops or whatever, rest stops along the way, you got people from all over. They're not just from Mississippi. If you're in Mississippi, they could be from, who knows, California, Florida, wherever there's an outbreak, as Dr. Phillips said, they could be there. So these are the things that distress me the most. You know, we've got to do something. Side effects are there. No vaccine is 100% perfect. No vaccine is without any risk at all. But everything you take, you put into your body has some type of risk with that. So I just want to say that part, and then I'm going to yield to Dr. Phillips, let him add on to his illustrious things that he always tells us. So,
well, you said it pretty much all of it. I mean, what I would add to it is this. Look, the chances of you getting a clot if you got COVID is way higher than what you would have if you were vaccinated. The chances of you having residual heart problems after COVID is much higher than what you would have after the myocarditis incidents that they've seen with these young men. So again, yes, these side effects are things that, are anecdotally, significant, but collectively looking at that versus what COVID can do to you, it's really negligible. And it's not really significant enough where we would stop. So that would be the only thing I would add is the chance of you getting all of those symptoms that you concerned about are much greater if you get COVID than from the vaccine.
I mean, the incidence of heart disease in children, if they get COVID-19, is much greater than getting the myocarditis or the pericarditis from the vaccine. I mean, would you want your child to be at risk for dying from heart disease or the MIS-C? I mean, we even had an adolescent girl that had a heart attack with residual effect from getting COVID. She was not vaccinated, and she was a teenager. She was an adolescent. I think this was right before the vaccine became available for her. And I know there's some people out there saying we shouldn't rush to vaccinate the children under 12 years of age. I know that, but that's controversial in the medical community, because if you look at things all together, what is going to be the problem with the children under that age group? Like Brother Gardner said, they're going to be the ones that probably pick up the virus, get the disease, have very, very few symptoms, but pass it on to the next person. So you got to take some type of precaution when you take your children out. I saw children on this trip with no mask on. Some of them had sniffles and things like that. If I went into any place where I wasn't sure on this trip, and you guys know me, I had my mask on. I had my mask on more than not having my mask on. There were times when we were outdoors somewhere in a big situation, in a parking lot, I might not have had my mask on. But if I went inside that store, or any place where somebody was within 10 feet of me, let alone 6 feet of me, I had my mask on. Because to me, that's what we're going to need to do to get back. Everybody wants to go back to normal. Like Virginia, all their restrictions are gone as of today. Maryland, I think, is tomorrow. DC, I think, is the 15th. All the restrictions, the COVID-19 restrictions are just gone. So people are going to run en masse to restaurants, theaters, and different things like that. But would you really want to be shut up in a theater that has poor ventilation if you're not vaccinated without a mask? I wouldn't.
I just wanted to add on. I'm sorry, Brother Gardner. Just back to the medical thing before we go to you. The cases of myocarditis that we've seen, basically all of them have been mild. So myocarditis, it resolved without issue. So again, when we start making these side effects the issue, and you look at really how significant the side effects are in the bigger picture, it's really minuscule. Secondly, if you go into school in Georgia, I think y'all start in August. So how long does it take to get fully vaccinated? It takes about 6 weeks if you get Moderna, and Pfizer is 5 weeks. So you need to start thinking about it, because the school system is going to do what they're going to do, and you may continue to impair your child who's probably already been negatively impacted by waiting. So whatever you're waiting for, you need to come to some conclusion with it to make a decision, because the school system's not going to give you an excuse, especially as we've seen how people of color throughout this pandemic, how we are treated in all of these different arenas, education, medicine, social justice, etc., in comparison to our Caucasian counterparts. And we've already seen that our young people have been impacted inordinately by how their education and their development has been interrupted. And it will continue to be interrupted if you don't answer the question for yourself, in a timely fashion, because they're saying in Georgia, you need to get your question beginning and answered by July 1st. So you can be on time and fully vaccinated by the time school starts in mid-August. I'm sorry, Brother Gardner, you go right ahead, sir.
No, I just love the intensity and the passion that you and Brother Dr. Boykin have. But I was going to boil it down because I'm a country boy from Georgia, and I like to spit like this here. The question, bottom line, everything you're saying right now is, what is the level of risk that the individual is willing to take for themselves and their family? It all boils down to risk level and risk tolerance, right? And some people's risk tolerance is higher than others. Brother Boykin, Brother Phillips, you guys have beat this drum better than anybody I know. I mean, I could can you guys and take y'all anywhere, put you anywhere against anyone. But right now, where we are right now in our society, where we are is risk tolerance. How much risk are we willing to take as a society, as a nation, as an organization, as a fraternity called Omega Psi Phi, as a family unit, and as an individual, and as parents and as brothers and sisters? And if you don't ask yourself that risk question, and what am I contributing not only to my risk, but to somebody else's risk, everything else is for naught. The information, the data is out there, Brother Amphofo. We've done a great job of doing that. So now we're in risk tolerance. And once we look at the risk tolerance and risk level, then we start talking about, okay, how do we mitigate that risk? Because as we know, things are moving forward. And the part we have not talked about that I deal with also on a daily basis is what do we do if we get a spike and we have to turn things off and turn things down again? Because that could happen. I think Brother Phillips talked about that before, and Brother Boykin, the other session you had about what's happened in Brazil and happened in India. Don't ever think it's going to get that bad because we do have vaccines on our side here, but that could happen. And woe be unto the soul that's chosen not to get vaccinated. Okay, let's be very perfectly clear. If you're vaccinated, we're hopefully preaching to the choir, giving you some tidbits. But if you're not vaccinated, and I don't mean to sound crude again or rude, you're playing Russian roulette with yourself and your loved ones. And as I told my brother-in-law who's struggling with this decision, I'm not really concerned about you. I'm concerned about those that you leave behind in the morning because you left. If we're really being serious about this, sometimes we get very selfish and think about ourselves. And I can talk clearly about this one. It's not what's gone, but what's left behind. And the emotional scars and the physical and the mental and the social scars you got to deal with on a daily basis. Those demons you got to deal with, those people aren't here anymore. So if you're not vaccinated right now, I would pray that you take time to think about somebody else besides yourself. Because no matter how rotten you may think you are, there's somebody that still loves you. If it's just your mama, she still loves you. And you don't want those people that love you to have the pain and the agony of knowing that there was a shot out there that could have perhaps saved your life and saved some of the agony that you could put people through. It's a very simple choice. Again, risk tolerance.
Ladies and gentlemen, brothers and sisters that are with us, this is the 2nd District of Omega Psi Phi. We are here with the horsemen from the 2nd District, and we do this on a monthly basis. Doctors, you talked about something at the beginning, and normally, you know, we as Omega men, I'm probably going to have some people log off now. They're going to get upset with me. We as Omega men, you know, usually when we hear the term Delta, you know, it kind of, you know, does some, you know, some of us, you know, some of us AKA, some of us Zetas, you know, whatever. But, you know, when we hear the word Delta, some of us, you know, we just, you know, but in this case, unfortunately, with the seriousness of this, we now hear Delta as a variant. So, Dr. Boykin, you talked about this Delta variant. Could you tell what is a Delta variant? What is the concern? What is that all about so people can be informed?
Well, that's the newest mutant, if you will, that came out. I'm going to look back. I do know the classification of it. It is B.1.617.2 that originated in India. And that bad boy is very, very transmissible and highly disease producing. So that's why it's significant. It's now, you know, I was looking back today, I think probably back around the beginning of May, somewhere around the time, the amount of circulating Delta was like 5 or 6%. Now the amount of circulating Delta is about 20% and rising. It is going to take over Alpha, which is the B.1.1.7. It is right on track to overtake as the most predominant variant, and the one that's going to be a world circulating problem. India just didn't create this and got done with India. He said the United States is going to go to wherever country it wants to, and particularly those little countries that don't have access to the infrastructure that we have for vaccination and things like that. So it is a disease that's going to see a lot of people affected by it. And if you're not vaccinated, you're going to have some significant risk of picking up that Delta variant. And remember, you run the risk of getting seriously ill from that because you're not vaccinated. If you are vaccinated, as we talked about before, Moderna does show good production of antibodies against the Delta variant. And as Brother Gardner said, Pfizer's results will be out tomorrow. So we're hoping it will be similar efficacy against the Delta variant. But I'm sure people have heard and seen Dr. Fauci quoted. That is going to be the significant thing that's going to be a problem with containing this pandemic with the United States border. It's going to be a serious problem for us in the future if we don't get some type of handle on it, and as Brother Gardner said, some type of way to mitigate the spread of it, the risk of it. That Delta is going to be a big deal for people that are vaccinated and unvaccinated, if you will. So I would hope people would take a look at that because, as I said, from 5% at the beginning of May to 20% now at around the mid-June, that's a pretty significant rise in transmission in the general population. So I'll leave it at that.
Dr. Phillips?
Well, again, the Delta is a product of why it's a product of us not having enough vaccine worldwide. Because not having enough vaccine worldwide allows the virus to multiply. And when it multiplies, it mutates. And we've seen the Delta variant, which they say now we should start looking at England as a 2 to 3 month precursor of where we may be if we don't make changes. So again, when we started talking about the UK variant last year, they said it was about 60% more infectious than the original strain of COVID that we saw. This is now twice as infectious as that. So again, and right now we're seeing the rates doubling every 2 weeks over the past couple weeks. The number of Delta cases are doubling. So in those pockets, as Dr. Boykin said, as Brother Gardner said, those pockets of individuals and spaces where we don't have high levels of vaccination, these are areas where the Delta can take hold. Now, fortunately, with this newer data from the messenger RNA vaccines, they seem to have a good effect on the Delta variant. So again, another plug for being vaccinated, you have the ability. However, if we start to get a surge of it in these unvaccinated areas, the Delta variant could mutate and sidestep our vaccination, rendering what we've done ineffective. So again, the Delta variant is a product of what happens when we don't have vaccine around, seeing these mutations occur. And as we think about COVID, not just, you mentioned earlier that we have to start thinking about it, not just from ourselves, we have to also think about it, not just from us as the United States, but also part of the world village and family, because just as we got a Delta variant because we got all the vaccine, nobody else is vaccinated, the virus was able to multiply without any resistance. If we still have not spread the availability of vaccine throughout the world, we'll have another variant after Delta. So again, as you said earlier, Brother Gardner, what risk are we willing to tolerate as we move forward? The other thing we got to start looking at, when are you going to start looking at life bigger than yourself?
That's just as profound, bro. That's just as profound because I practice in a world where I have to accept the parents as the advocates for treating their children. Now, enough information is out there that recently there is a push, and this is probably goes on with Dr. Gardner is saying, what can we do? Well, one of the things we can do, some of these adolescents out there say, I don't want my parent to be making decisions for me about my vaccine. I want to make it myself. So there are some jurisdictions out there looking at changing the medical permission for getting the vaccines, allow these kids to make their own decision. So that would be one way we can do it. We can't always. I mean, as a matter of fact, I was just listening to a lady. I don't know where it was today or yesterday. She was pissed off because her son couldn't start college because until he was vaccinated. How dare they make a decision for me? Again, putting a political spin on it. People got to stop this political spin stuff and start looking at the reality of taking care of the world we live in. What good is politics if everybody's dead? Nothing. Nobody can make any policies. Nobody can do anything if everybody's dead because everybody thinks it's a infringement on their rights. And again, I'm not saying go get vaccinated, because I believe in that. It's not a political decision. It's a medical decision. We're in a pandemic. So I think that's one of the ways that I came across recently that, it's not there yet. But, adolescents may be given the permission to make their decisions about getting the vaccine when their parents don't want to, because in the end, if something happens to that kid because the parent made the decision, who's responsible? How would you feel as a parent if you made the decision not to get your child vaccinated, who wanted to get vaccinated, and they go out and die? How would you feel about that?
Brother Gardner, please.
Dr. Boykin, that's a very interesting question. And I agree with your passion, but as a parent, it's almost like a woman's body. I don't want the government telling the woman what to do with her body. And as bad as this pandemic is, because I'm a student of the idea that once you give up something, it's hard to get it back. And I agree with you 100% about getting kids vaccinated. But there's something about a parent-child relationship, if you're a good parent, that I don't want the government telling me that I got to do something. Understand what you're saying, but that's, there's so many ethical, moral, and philosophical positions that this thing is bringing about to us. It's a society bigger than man, an individual. Where do individual rights end and majority rights begin? All those kind of things, all those kind of discussions we have all the time. And one of the things that I'm really afraid of, because it's expedient right now to say that we can do that, but was to say 10 years down the road, people use this as an example to do something we don't like doing with our kids or we don't like doing with us, because the government can, and precedent's been set. So even in times of distress like now, I want to take a calculated and measured approach to whether or not the government could force or should be able to tell a child, a parent, what to do with a child, or give the child the right of, what's a good word? You guys are smart, man. Like I said, I'm from Georgia, that word when kids excommunicated, they let themselves go from the parents. Emancipate. That's it. See, I told you were smarter than I was. Emancipate themselves from the parents. I'm just not for that. I think we need to hold back a little bit. But I do understand why you say what you say, though.
Go ahead, Dr. Phillips, very, very quickly.
Well, real quick, what I would just say is I'll use this visual. Imagine you going in a party and there's security at the door. Or better yet, since you here for TSA, there's TSA pre-check and there's going through regular TSA check. And if your papers ain't right, what happens at TSA check? You got to go through all these stressful interactions with someone at the airport who may make you late or change your day. For the people with the TSA pre-check, we go on through and wave at you. And the check moments are coming up. It's coming up with school. It's coming up with jobs. And if you sit back waiting and don't make a definitive decision, either way, you're going to be put and stuck in that space of frustration because your progress is not going to happen, because you know what these institutions are doing? They're not just thinking about individuals. They got to think about entire groups of people. So as I said, as we move forward, we can't just think about this about ourselves. We got to think about our families. We got to think about our communities. We got to think about our states. We got to think about our country. And we've got to think about how we play a role in this world family. Because if COVID don't go nowhere internationally, maybe the next mutation might be the Omega mutation. You know, and we smiling, but that joint ain't gonna be no fun. It ain't gonna be no fun.
No.
So with that, I'll yield my time, brother DR. Thank you.
Yeah, no, thank you. It's bad enough. You know, we trying to clarify this Delta variant, and now you're talking about an Omega variant. We'd be in a whole bunch of trouble. If we can, Dr. Phillips or Dr. Boykin, if we can, just quickly, two things. One, for those that are vaccinated, anything we've heard of about the possibility of having to get, boosters? There's been talks about that. And if you could also, for those persons that are still on the fence and say somebody does want to get a vaccine, who should they contact? Where can they go for that information? Dr. Boykin, Dr. Phillips.
Okay, go ahead.
Again, contact your local Department of Health, local pharmacies. Check your website for state mass vaccination centers. If you're in New York, we're out at Jones Beach. So again, the issue is not vaccination availability. The issue, unfortunately, is willingness and interest to get vaccinated. So just as much as we give information about where to go, we probably also need to be given information about why they should go. So we need to, as we have said many times on our COVID task force call, we need to empower all of our COVID ambassadors right now to get involved. So, Dr. Boykin, go ahead, sir. I'm sorry.
No, I was going to say my first and foremost question to you is if you're thinking about getting a vaccine at all, that's a discussion you need to have, not from here, not make a decision, because we're not giving out medical advice on here. We're just giving out information or our opinions in most cases. You should really discuss with your personal care provider whether or not you should get vaccinated if you decide to get vaccinated. And if you are vaccinated, there's varying studies out there. Some say 6 months, we get good antibodies. Recent things show that we get a year. And a recent study that's yet to come out saying we might be lifelong. I mean, we still don't know the answer to that final type thing. But we need to prepare ourselves as if we don't have any lifelong immunity, or we don't. So if you're going to get the vaccine, that's the first step. The second step is be prepared for whatever may come down the road, which could be nothing, if we have lifelong immunity to it. But again, if we want to get back to where we need to be, we got to do some things to do that. And I want to say that I'm not advocating kids to go out and the government to take control of people's parental rights. That's not my passion at all. But my passion is that there should be a conversation between that child and that parent. If that child really wants to get vaccinated, to find out what is the reason for it. That's like we said, if you don't want to get vaccinated, we got to say, listen, what are your reasons why you don't want to get vaccinated? If a child wants to get vaccinated and you as a parent, just because you're saying I'm the parent, you shouldn't get vaccinated, then that child-parent relationship to me is kind of holds, because you're not listening to your child's reason for why you want to get vaccinated. Yeah, you might still have the decision in the end, but don't make it a political one. Make it a family one, a spiritual one, that that you're doing what's right for your family based on your beliefs and your religion. So that's what I want to say to that effect too.
We are exactly at 3 minutes, so each of you will get your 1 minute close. Let me not get in the cut. So Dr. Boykin, your closing statements, please.
Well, I just want everybody to most of all, be careful this upcoming holiday. Be safe. Don't take any risk out there. If you're vaccinated, there's still risk for you. If you're unvaccinated, there's risk for you. Do the right thing. And as Brother Gardner said, don't think about yourself. Think about others. Are you going to be a conduit to spread it to others if you don't wear your mask or wash your hands if you're not vaccinated, or even if you're vaccinated? Because, hey, I'm going to be around a bunch of people this holiday weekend. I'm wearing my mask and I'm fully vaccinated. But that's just me. So I just say, please be safe. Safe travels. And when you go into places where you haven't been before along the way, like I did this past last week, take note of what's happening around you. If a bunch of people are gathering and then they're not taking any precautions, do you want to be in that situation, or do you want to go around them to get what you need to get? So just be careful and be safe and practice good mitigation, whether you're vaccinated or not, at this upcoming holiday. Thank you.
Dr. Phillips.
Again, Dr. Boykin always says it all and leaves a little bit for me to say. And I feel like I just want to say nothing and say, listen to what he just said. But again, it's a critical weekend, y'all. and we are not out of the woods yet. Again, there's a lot of risk out here for people who are not vaccinated, for people, if you are vaccinated and you're going to be in situations or scenarios that may be unsafe. So we've got to continue to be vigilant with our safety measures. Again, as we look at as entities in the community, organizations, maybe we need to be more of a lean in these conversations where people have hesitancy, because there's a lot of hesitancy out here. And when you sit down and ask somebody, well, what you waiting for, when they say I'm waiting? I'm just waiting. They're not waiting for some statistic or some variable. Again, they just waiting, and just waiting can just pass by. And you could have said, wow, I could have been vaccinated, and now I'm dealing with COVID. So as I close, I'm just going to leave it with this. I had a patient who's 44 years old. She was overweight. She did not get vaccinated. She got COVID. She now has left-sided weakness and is unable to walk independently, and she didn't have a stroke. She has a healing scar in her neck from the tracheotomy, which was the device that assisted her in breathing. And now her adult children have to take her to all of her doctor's appointments. And we are trying to get her a home aide and physical therapist to come to the house. And the only thing that she had working against her before was she's a little bit overweight. But this is how unpredictable COVID has been and still continues to be. So with that, as it was said earlier, do you want to roll the dice on things you're not sure about? So educate yourself. If you know someone that you care about or don't care about that is operating on false information, as an individual or as organizations who are trusted in our communities, we need to get involved in as Dr. Boykin said, the why part. Well, why are you reluctant to get the vaccine? So with that being said, God bless and stay safe.
Thank you so much, Dr. Phillips. Brother Gardner.
About 120 days ago, we all saw the president on television, and he set out an ambitious goal to get 70% of Americans vaccinated. Just last week, the administration openly admitted that we would meet that goal. I think we were hovering right around 59 or 60%. If you look back in our history, normally when the president says we're going to do something, there's been a rallying around the flag. We all come together and we do that. And why, we must ask ourselves why we didn't. As Brother Boykin mentioned earlier, this has been embroiled in politics. We can't separate that fact. The fact that we did not reach that 70% it tells us we will not reach the herd immunity, as the doctors have talked about all these past sessions and whatnot. So what does that mean? As I said earlier, it's about risk tolerance. We don't want to beat up anybody. It's just, this is a forum to give out information. You've got to make those own personal choices about what you want to do for yourself and your families. And remember, it's not about me. It's not about I. It's about us. It's about we. It's about us and the plurality of this union. And so my message to everyone here is to have a happy 4th of July and recognize that although you can see the finish line and the sun is coming up, we're not out of this pandemic. And it may change for a lot of people, but if it impacts you and impacts your family, that's going to be catastrophic. The world will come to an end as you know it. So don't let it happen to yourself, brothers, and your families. Do what you got to do. Do it now, so later on we can do what we want to do. Brother and folk, well, thank you for the time. I yield back to you now.
Thank you so much. As always, our disclaimer, the comments and views that you've heard on this evening, they are expressed by the individuals themselves. Does not necessarily represent the Omega Psi Phi Fraternity Incorporated or the entities that these fine gentlemen may be affiliated with. As you've already heard, the 4th of July is coming. And so we want to wish all of you a safe and wonderful holiday. As always, we acknowledge our Grand Basileus, Dr. David E. Marion, members of the Supreme Council that have joined us this evening. Thank you so much. Members of our District Council who have joined us tonight. Thank you so much. Members of our National Pan-Hellenic Council, excuse me, the Great and the Great Eight, as some of us learned it, but most importantly, it's the Divine Nine. We're all in this together. Thank you all so much. Don't forget about our partners, the American Red Cross and our National Kidney Foundation. Please visit their websites, take part. Thank you to our producer, Brother Piercy, and all the brothers running the scenes, Brother Worley behind the scenes, and Brother Ed Hill, making sure that we can share this information with you all. We'll see you all again on the last Wednesday of July. Stay safe, stay well, and God bless.